Kadri. On today's edition of the program, our focus is on tackling maternal mortality. And on that, we shall be taking a dive on the health status of women, children, and adolescents. You all know the ugly statistics as at 2018, where we have the NDH report. It's so sad that 512 women, out of 100,000 live births die. And then we have 100,000 of infants die. It's a statistics that is ugly, and we have had both the federal government, development partners, putting efforts to see how that can be reduced. And to look at that on this program for today, I have with me two ladies. From our far right, Amina Haladu. She is the program delivery from the AHBN. And of course, close to me is Oyeyemi Piton. She is the head Gem Hub initiative here in Abuja. You all are welcome.
Thank you so much for having us.
So you have to take the first shot.
Okay.
Yeah, there's so much that we all know concerning the health status of women, children, and adolescents. We really cannot exhaust it, ranging from access to healthcare to inability for them to get basic commodity, for example, in terms of family planning commodities. And then for the adolescent, they don't even have the information on where they can actually get, these commodities. Not talk of children that are helpless, under 5 kids, that most of them, malaria knocked them off as if they are humans. So in all of this, what are your thoughts?
Okay, well, I think you've actually mentioned the fact that the figures are not looking good. We know that women still die. The maternal mortality rate is still very high. In fact, the statistics they are still using and quoting is as at 2018. So right now, I'm sure the figures would have changed, whether for good or for worse.
We're expecting another launch.
So, the same thing as the infant mortality rate, but it's also good to identify the fact that despite all of the issues and all of the problems, the government of Nigeria has actually identified these issues and have made commitments. They've made commitments at the global level, even at the regional level, down even to the national. Commitments to improve the health and well-being of women, children, and adolescents. But to what extent have we, made do of these commitments? To what extent have all of these commitments been translated into implementation? That is where the question is. Like you rightly said, access to healthcare, quality healthcare, basic healthcare. That is still questionable. If you go to your community or probably your village, for example, you want to see what the state of the primary healthcare looks like. It may not be palatable, right? Even though there are different initiatives, and that is why we are here, because of course we know that with support from the PMNCH, that's PMNCH, a global initiative supporting African Budget Network, to actually come together and look at all of the commitments that the government of Nigeria has actually made when it comes to the health and well-being of women, children, and adolescents. We look at it, we look at the quality of these commitments in terms of, is there a policy or act or a framework in which these commitments can actually fly? We also look at the technicality. What are the components? Are they smart? Are they realistic? Are they achievable? Or is it just word of mouth? So we are looking at what's the technicality of all of these commitments, and also the extent in which they are implemented, so that we can actually come together and approach the right stakeholders, the government where it's government, the CSOs where it's CSOs, the partners, international partners where it's international partners, to say, these are the commitments that have been made. How are we going to ensure that we improve on the policy, or we ensure that there are policies in place to implement them? Or this is what you have said in terms of implementation. How far can you also go in ensuring that all of these commitments have been implemented?
Yeah, I like us to be specific. And by that, let's take women. You know, the rate of mortality is not pleasant. It has been said that on a daily basis, 150 pregnant women will die. You know, but nothing is not hiking anybody, right? Because you don't actually
Feel it.
no, they are not together. Like if you have a
Costly.
Boeing 737 crashed, you understand, carrying 150 people, you know, it will make news, it will make headline for, let's say, for 10 days, right? You are going to have people interrogate why. You are going to have people going back to that side who, and the people that it affected, you know, and all of that. But when you now have a statistic that says on a daily basis 150 pregnant women die, it could be in Karanamoda, in Zamfara, Gamburungala, Meduguri, Agenebode, Edo, you know, Bomosho, and all of that. So because they are not together, people don't really worry now. So the commitment that we know where the federal government had, you know, alongside with the UNFPA, that basket fund of $4 million to procure family planning commodity. Because if you plan the family, there will be less casualty, there will be less fatality. Women will survive. How is that going?
Okay. So, like I said, we actually looked at all of the commitments, and what this is one of the things that we looked at. You know, Nigeria actually made commitments towards the FP 2030, and one of the financial commitments is this that we mentioned. And we could say that 2 years ago, none of that funds actually came out. I think with series of advocacy last year, the fund actually was, you know, disbursed for it to be used. So beyond all of that, it's for Nigerian government to take ownership, right? We need to be convinced that this is the direction we want to go. We already have goals, and well, one way or the other, we can see that with the sector-wide approach that the Honorable Coordinating Minister is actually proposing, where they have the NSHRIP, and that is actually the direction. So I want to say kudos to the direction in which it's been taken, but in piecemeal to say all of these commitments, there are commitments that have already been made. In as much as there's a new administration at the Ministry of Health, is actually to look at all of these commitments that have been made and to what extent. And so we are looking towards, you know, sharing the results of our findings to say, while you are going towards sector-wide approach, this is what we have identified. We have looked into all of the commitments that have been made by the federal government. For example, the National Health Act 2014, which actually stated that 1% of the consolidated revenue fund would be earmarked for health, right? Also that 1% of every national and even state health budget will be earmarked for family planning. To what extent is that being done? Beyond the national level, state level, like you rightly said, it's in the state that these things are felt at the grassroots. So to what extent are state governments committed to the health and well-being of women, children, and adolescents in their states? Because these are the things that will show. Money says, there's that money answers all things.
All things, yeah.
So you can say all of the things that you want to say, that this is what I want to do and all of that, but your money should be going to that direction. And so we are going to, you know, we look forward, because of course we have done the scoping, we identified all of the commitments, we identified the policies, we identified even the financial commitments that was made, and then we looked into to what extent are these being implemented. So we look forward to present this, you know, to the government to say.
Okay, so now let's go to Amina Bahanadu, your remarks. Health status for women, children, and adults.
Oh, so like we were rightly speaking, the numbers are not looking the greatest. But then I also think there are so many parts that could go into it. We are talking about you know, how we're talking about the antenatal days. We have to raise voices on that. I think for me, realistically, what I have to say is we have to be very vocal about this. We have to be informative to the people as well. So we have to tell them, this and this services are available for you. And sometimes you could be shocked, it's just a matter of information to the right specific things. Also, there are also some times where some services are not accessible to some people because they are in mixed communities, especially if they're in societies where there are security issues. So I think we also need to look further into the commitments and ensure when we're talking about the quality of the commitments, we are ensuring that people in the mixed communities are being approached. But the numbers are not really looking good. So we're talking about the
when you look at the Primary Healthcare Development Agency, which is one of the gates to the what you mentioned, the Basic Healthcare Provision Fund, 50% is what they got from that 1%, which is in the neighborhood of 25-30 million. No, 25-30 billion. Yeah, 25 it's about 55-60 billion, you know. So that amount of money is given to the two gates, the NHIA and the NHCDA. Now,
I think NCDC is also now
part of it.
For NHI, 45%. Then for emergency services, it used to be 5%. It is now reduced to 2.5%, while NCDC takes the remaining 2.5%.
Yes.
That sums it up to 100%. So, for children, you know, we say women, children, and adolescents. Primary healthcare, NPHCDA is really responsible for children, so to speak, immunization, routine immunization, and all of that. But you know, recently when we had the outbreak of diphtheria, it was as a result of gap, of not administering, you know, those two vaccines. So, what are we doing in terms of ensuring that children get routine immunization? Are we following? If we are, is it looking good? Because that is what you need to prevent the deaths.
actually.
Yeah, so I think I could start with it. I think so we're talking about, first of all, we also have to understand the number of children that we have that are not yet being immunized. So that's why we have Papa LQA, we have LQA sampling going around, because we have to understand how many children we're talking about that are not being immunized in order to sufficiently take care of that. So that is also part of it. But I think we're also now, you know, for the most part, sometimes we used to look at maternal, newborn and adolescent health, but we usually used to leave the adolescents behind. But we're also, I think it's a big mistake, because they're a big.
Leave adolescents behind?
That's a good question. It's something that we need to improve, because they are a big demographic. And sometimes when people hear adolescent, they always imagine young people. But we're also forgetting that some of those adolescents are also mothers themselves. And if an adolescent person is not well guided, is not well coached over life, they're already at a risk stage in their life. Age is not being the best. So so when we have that combination,
you don't have a child, giving birth to a child.
Exactly. So when we have that combination, we need proper guidance on what should be done. We need proper education, proper health and everything. So once
who should do that?
So
who should guide them?
The
adolescent.
It should be a part of. So I know the primary healthcare should have do have counselors, but then again, a lot of people do not necessarily know the guiding and counseling happens. So that's where advocacy needs to be done. In these cases, like I say, when we have adolescents giving birth to children, the combination is not really going to be helpful.
Saying, the guidance and counseling department, whether the Federal Ministry of Health or the Federal Ministry of Women Affairs, and then to subnational, they are not living up to expectations. Absolutely
not. But I think these are some things we have to do. Identifying gaps is one thing, providing solutions to that is another. So I think that's where we have to amplify it.
And to add to that, because she actually did a good job to that, is that at the end of the day, it's about the society. It's about everybody even owning up to say we are all in this. So government cannot do it alone. So while government is doing
we are
what
all
they
in
can,
what?
we are all in this. We are all stakeholders, individuals, parents, teachers. And so that's why it has to be a multi-stakeholder kind of conversation. Everybody do your bit. While government is looking at the bigger picture, enabling environment, and putting policies in place and implementing them and making sure there are funds available, parents are also taking ownership. These are your children. It is your duty to take your child for immunization. So what is the role of the government? The role of the government is to educate, ensure that parents know the importance of immunization. You parents, be open-minded. You want to save your child. Embrace it. Immunization is good for your child. You should immunize your child.
Exactly.
There are vaccine preventable diseases. There are some diseases you don't even have a business. A child does not have a business having such diseases. If
Like
you immunize them, for example. So immunization is key, and every parent have a duty to take their children for immunization. Don't wait for any incentive. Don't wait for anything. Just take ownership and
But have you found out if the vaccines are there?
That's another thing. So that's why I said everybody's on. It's two ways: the demand side and the supply side. For the supply side, the vaccines should be there. And so there's a whole lot of improvement, but it's case by case. So you get to some states, the vaccines are there. You get to some states, the vaccines are not there. You get to some states, the vaccines are there, maybe load up in the store at the state level. Now it's logistics funds that is now the problem. So they are unable to actually, take them to all the LGAs where they are being needed. That's another thing. So that's where they are calling on the government not only at the national level, but at the state level. Local government chairman, take ownership. You understand? We should just take ownership, because at the end of the day, if you look at immunization, for example, a chunk of the funds being run that is running immunization is coming from outside the country. But this is our lives. If Gavi pulls out, if all UNICEF and all of these people, if they are not putting their money, I don't even know what we'll be talking about.
Yeah, so that brings...
So it's important for the state government, for the local government, for mothers, for parents, for the chief, for everybody, all the stakeholders to take ownership.
Yeah, so that also brings another question of sustainability, because as we all know, Nigeria is heavily running all of these programs based on donor partners. So the big question is, what happens when the donor partners are no longer here? What is the sustainability plan? Which is, again, a bigger conversation that we need to have. We still have the donor plans. We're still talking about, release of funds and implementation, even when the donor funds are being available. So I think a deeper conversation also needs to come and be had over when it comes to, when a fund is being allocated to a certain thing, how is it being, we have to follow the path when it comes to, advocacy as well as accountability of the commitment being made. We have to talk about how is it following? Has it been released? If it has been released, how has it been implemented? So that is also another conversation that we would have to put together.
There are so many things to actually look at when it comes to the health status, or improving the health status for women, children, and adolescents. It's one thing to allocate resources, another thing is to release that resources, and then find out if that money
has been implemented.
To procure what it was meant for. And if that is procured, did it go to the target audience?
Yes.
If it, possibility that it went there, can people access it? I have been in a place where a woman came to the center to, get one of the matrons of family plan. And she was told, okay, it's free, but you need to pay some money. This is a rural community where it's difficult for them to part with 100 naira. And they have been told, just go there and do it. It is free, and it will help you, space your children. And the woman got there. She was asked to pay 1,000 naira. They call it for logistics. Yeah, for the gloves. And
sometimes even the card.
And the woman said, I don't have that kind of money. I either you give me or you forget about it. So what are we saying? There are so many challenges that we know, like I've mentioned. Logistics is one, where a woman in the rural community goes to healthcare center to assess family planning commodity so that she can actually, space her children and, reduce to the barest minimum issues around mortality while giving birth. And she's told you need to pay, 1,000 naira. She says, I don't have. It's either you administer it to me or you forget about it. How can we check those things?
So, and this is actually very true. This is what happens where, people are told one thing in the community when they are doing mobilization or probably creating awareness, and then they get to the point where they want a point of service and the whole thing changes. And then they are asking them, you have to pay this, you have to, these are barriers, right? It's systemic. It's an issue that needs to be addressed. And at the end of the day, if you go to the primary health centers and you ask them, asking them, why are you charging? They said this is supposed to be free. They will tell you that, okay, we don't have funds to buy syringe, for example, or the gloves, for example. So it's just the little things that we ask them. To them, they are asking for the little things. But what the government is saying that it's supposed to be free. So these are barriers. So in tackling this barrier is actually to look along all the value chain. What are the key things? Are the monies getting to the facility at the right time? Is another thing to say money has been earmarked for a particular purpose. Is another thing to release that funds at the right time. Now, I need funds 8 a.m. You are sending it 9 p.m. It's not going to meet. So you have given me an opportunity to even use that money for another purpose. So release of funds, timely release of funds is very important. And that is why we are coming together as civil society organizations. AHBN will support from PMNCH, that's the Partnership for Maternal Newborn Child Health, right? AHBN is coordinating the development of collaborative advocacy action plan in Nigeria. So alongside with civil society organizations, media, that's health journalists, academia, persons living with disability, just to ensure that we include everybody.
Yeah, but to what extent will that address the issue?
It is going to address it. It is going to address it because we are coming
to what
together.
extent would that put money on the table for vaccination? To what extent would
you are talking about
we have had series of discussion around locally manufactured vaccine or production of vaccine locally. It is as if it's not happening. I remember when the former president gave a matching order to the then Minister of Health, Dr. Ehanire, nothing happened. And we have also heard that the current president, Bola Ahmed Tinubu, is also, supporting the production of vaccines locally, but nothing is happening.
Okay, well, it may seem like nothing is happening. So just to drive the point I was making, was the fact that when we come together, which we are coming together next week, when we come together, an assessment has been done, right? We are going to validate that assessment and we are going to develop an advocacy plan where we are not just beating around the bush. We are going to the key issues, right? Identifying that to this point you have done well. To this point there's still gaps, right? How do we fix it? Now there's a direction that the government is going through the coordinating Minister of Health, saying that he has 4 or 5 pillars that he wants to tackle. And one of the things that you mentioned, clashing maternal mortality rate, is one of the things that he said he wants to tackle.
But all those things
let's give it a trial.
Still on the archive.
No. They're actually
nothing has been done. We have not seen anything.
I'm not speaking for the government.
Yeah, but have you seen any of those?
No, but here is the thing. In not seeing some of this, and there are things that are already happening, and I think that's where the a collaborative advocacy action plan is important. Here is the thing. Yeah, I think an advocacy action plan, and I mean the word collaborative, where everybody would be in the same room as we are identifying the gaps. as we're identifying the challenges. So I'm talking about CSOs, that their voices are quite loud. And then we have the government officials, we have academia, we have research institutions. So as we are all identifying these gaps together, even if we realize something is not happening, then we realize, we now ask the question, why is it not happening? So we do it collectively together, then we make advocacy. Everybody will make his bit of advocacy, targeting different things, hitting the nail on its head, and that would drive to action.
Not doing it in isolation.
Absolutely not.
Of what the government is saying that they want to do. So in not speaking for the government is to acknowledge the fact that they are actually putting systems in place in order to be able to implement this. In terms of there's ministerial oversight committee that has been established, where there are different technical working groups to ensure that all of these big and beautiful goals that the government has set for themselves, there's a framework and there's a system, there's a mechanism in which they would drive that, right? One of the things that they also want to drive is the basic healthcare provision fund, right? And then we've heard that, of course, monies are being released, right? So it's for everybody. Like I said, my own concept is the fact that not only government is on this thing, everybody, our journalists, when they are saying that we've released, how are we following the money? How are we ensuring that this money that they said has been released, is it getting to the facility? Has it gotten to the facility? It's for us to ask your facility, have you gotten your own funds to be able to run things? Because it starts from there. When you say you are sending funds and then people are saying that they've not received it, they are forced to actually generate funds for themselves. Then they have to ask something that's supposed to be free. They are going to be asking, okay, just pay. To them it's peanuts, but it's something that is going to actually deprive people from coming.
It's not as if they don't have the money, but they can't part with such money.
Exactly, that's what I'm saying, and that's the barrier. And that
is a barrier.
So we should be able to have, like you all have said, in concluding the program, time is not our friend here. We should have a system whereby all these things are done, transparently.
Yes.
So that at the time the end user is going to seek for that service, or service as the case may be, he or she is sure of not going and coming back empty, but going there and then coming back with, services well rendered to him or, well, to her. About women.
We're talking about women.
Of course, including him.
Yeah, but
Yes.
the children.
Absolutely.
And adolescents.
And adolescents could be, yes. And then again, when we're talking about women, we're also talking about sexual and reproductive health. And men are actually also a good chunk of that. You will be shocked to find that out. Absolutely.
All right, that's the most we have on this discussion segment. It has been with Amina Haladu, the program delivery and francophone liaison for AHVN, and of course with Uyemi Piton. Well, the lady I like so much about collaborating. Well, it's good to collaborate. She's the head for Gen Herb Initiative. Thank you all for coming.
Thank you for having us.
We end it here. See you somewhere.